We are live, Doctor. You can start the session.
Okay. So, good evening, friends, and good evening, all the postgraduates and all the participants and all the mentors who have joined us logged in for this particular brain teaser quiz. Well, this is a pan India, all India intercollegiate quiz, which is hosted by Brain Teasers in association with Ophthalmological Society of Nagpur. And the thing is, it's called the Big Q. Well, this is the
आठ समंदर अपना अंबर
साला कुछ
खोज
जीतना
ले
ही
अब
नहीं
तू अपने दम पर भूख मार के धूल झाड़ ले छोड़ छाड़ के सारे छप्पर आठ समंदर अपना अंबर खोज ले अब तू अपने दम पर भूख मार के धूल झाड़ ले छोड़ छाड़ के सारे छप्पर खोल दे पर खोल दे पर खोल दे पर खोल दे पर बंद घड़ी की भी रुकी हुई सुई होती सही दो दफा चुप क्यों है रहना मन का तू कहना रोके चाहे हिचकियां खोल दे पर खोल दे पर खोल दे पर
yeah. So once more, good evening, friends, and my pranam to all the mentors. Here, Brain Teaser team is here to welcome you all for the second episode of this fourth season of Big Q. Well, Brain Teaser is an online platform which has grown year after year. It began 6 years, about 6 years before, when we started with a small mailers where we used to send questions. Since then, it has grown leaps and bounds. Initially, for first 3 years, we had quizzes for comprehensive ophthalmologists only. And then the thought came, why not for all the postgraduates? Let's join get all the postgraduates on a common platform. And that was how Big Q came into existence. So this is our fourth season. Last season, we had a phenomenal participation. We had 320 institutions, 320 teams. No, sorry. It was
600 teams.
600 teams which had logged in out of the. Remember, there are 320 institutions in our country which are offering DNB to be aired on alternate Wednesdays at 7:30 p.m. Brain Teaser is extremely thankful to the Quizmaster team of Team Quizmasters who toil hard to create a wonderful experience of learning with fun. Today, the theme is going to be cornea, and we have three top cornea surgeons from our country who are going to be the quiz masters. Besides being avid cornea surgeons in themselves, they are also avid quiz masters. So the first quiz master is Dr. Karan Bhatia, who is a senior consultant at Manatkala Eye and Maternity Home, Meerut, and vice president of YOSI and an ambassador of Eye Foundation America. Dr. Tushar Grover, who is a medical director of Vision Eye Center and a consultant at Sir Gangaram Hospital, Delhi, again a cornea surgeon, and a veteran cornea surgeon, my dear friend Dr. Madhu Raju, who is a chairman and managing director of Ramana Raju's Vision Tree, Vishakhapatnam, and also he is a chairman of Scientific Committee of Andhra Pradesh Ophthalmological Society. So thank you all the three quiz masters for being with us and toiling hard to get all this question back for us. Nothing is possible without a money, and it is an old saying which says, money maketh the mayor go. Such mega projects are not possible without a strong financial support from pharma. This year, His Highness has been our partner. My sincere most gratitude to Mr. Suryanan, Mr. Naresh Rautela, and Mr. Kaustubh for their support and pushing us to start this season early. I would fail in my duties if I don't acknowledge the field force of His Highness, who made so much of efforts to enroll all the postgraduates from across the country. Smooth and flawless execution of any online platform, and especially the Brain Teaser platform, is not that easy, and all that has been taken care by Numerotech. My sincere most thank to Sai and his team. And last but not the least, my co-host, Dr. Shilpi, who helps me out with everything in this particular show. So over to you, Shilpi, for familiarizing all the contestants with the rules of the quiz and then proceeding further.
So, good evening, friends, and welcome back to the second episode of Big Q Season 4. So let's see what is the format of the quiz. So yes, we have already explained to you that there will be 6 preliminary rounds. So what is the criteria for qualifying for the quarterfinals? So we will take the best 4 performances out of the 6 rounds. So if any of your friends, those who haven't played the first round, and even if they have missed the second round, still they have the chance to make into the quarterfinals if they play next 4 rounds. So for this, we need 2 platforms, that is the Kahoot platform, and you need to log in from the 2 devices. First is for the quizzing, which will happen on the Zoom platform. So to monitor the teams, your video should be on and audio should be off. The second screen is the Kahoot platform to answer the questions. I request mentors to log in from the separate screen only on the Zoom platform. So in today's quiz, we have made a little bit changes. So there will be 6 sets of MCQs. You will have 5 questions in each set and you will get 10 seconds per question. There will be no negative marking in any of the questions. The next set is the 2 sets of the unscramble the words. There also you will have 5 questions in each set and you will get 30 seconds per question. And the last is the 1 word answer for which you will get 20 seconds per question. So these are the prizes for the postgraduates during the finals, while the audience prizes are per episode. So the third prize is 2,000 rupees, the second is 3,000, and the winner will get the 5,000 rupees per episode. So just to check whether your Kahoot platform is working properly or not, this is the sample question for you. Which hockey player is conferred the prestigious Padma Shri Award? And your options are option A, Harbinder Singh, option B, Bholanath Singh, option C, Padma Dilip Tirke, and option D, Vivek Prasad. And your time starts now. Just remember, you'll have to press the answers, the option only after the timer starts. If you will press the answer before the timer starts, it will not be registered. So let's see what is the correct answer for this question. It's option A, Harbinder Singh. So with this, I have the privilege to introduce our first quiz master, Dr. Karan Bhatia, who is a terrific cornea, cataract, anterior segment and refractive surgeon. As already informed, he is a vice president of YOSI and ambassador of Eye Foundation of America. He has so many awards to his credit that if I start reading all the awards, it will take a lot of time. So I'm just displaying this screen. And for the academic purpose, he has developed the MYX technique of SFIL implantation. He is the chief and co-instructor and invited faculty at various international, national, and state level forums. He has published many papers in the reputed international journals. And he has planned and conducted the AIS YOSI Forum of 2019 to 23, Yo Pavilion at AISC 2020 from 2020 to 23, YOSICON 2024, UPCon 24, Merit Society. And he has conducted, moderated, and presented at many webinars with a special focus to the young ophthalmologists and residents. So with this, I hand over the screen to Dr. Karan Bhatia for further proceedings. Dr. Karan?
Yes, thank you, Shilpi, for the kind introduction. And thank you to Prashant sir and you for this wonderful opportunity. Yes, can we go to the next slide? So let's start with the first set of MCQ questions. So the question is the phenomena of alternating dark and light bands observed in keratoconus is attributed to option A, collagen fibril degeneration, option B, infiltration of the inflammatory cells, option C, changes in the Bowman's layer, or option D, increased deposition of proteoglycans. The time starts now. And the correct answer is collagen fibril degeneration. Let's go to the next question. What is true about a LASIK flap created by femtosecond laser? Option A meniscus flap is created. Option B, a planar flap is created. Option C, easy flap dissection in comparison to microkeratome. And option D, decreased flap size. Your time starts now. So the correct answer is a planar flap is created. A meniscus flap is what you would see when you use a microkeratome. It's thinner in the center and thicker in the periphery. And even there's about an error of about 30, 40, 20 to 40 a microkeratome. But in LASIK, it's all the error is about less than 5 to 10 microns, and it creates a planar flap. The dissection is slightly more, it's more tough in comparison to a microkeratome, and you can choose your flap size. Let's go to the next. So, lenticuloschisis, a no dissection technique, has been described by option A, Sachdev M. Etal, option B, Ganesh S. Etal, option C, Ramamurthy Etal, and option D, Chaudhary Etal. The time starts now. So the correct answer to this is Ganesh, Sri Ganesh sir had made this technique. It's for smile and it's been recently published. You should go and take a look at it. Let's go to the next question. The substantia propria of the cornea proper of the cornea receives its blood supply from option A, medial and lateral palpebral arteries, option B, anterior ciliary arteries, option C, circulus arteriosus major, and option D, none of the above. Your time starts now. So the correct answer to this is none of the above, since the cornea is an avascular structure. Go to the next question, please. So pain, which is a constant feature of corneal ulcers, is out of proportion to findings in option A, typical hypopyon corneal ulcers, option B, herpetic corneal ulcers, and option C, acanthamoeba corneal ulcers, and option D, neuroparalytic corneal ulcers. Your time starts now. So this is a very classical sign. So the correct answer is acanthamoeba corneal ulcers. Next question, please. Okay. So I'd like to introduce the other quiz master, Dr. Tushar Grover, who's the medical director of Vision Eye Center and also a consultant at Sri Gangaram Hospital. He's a cornea, cataract, and refractive surgeon who's trained from Arvind Eye Hospital, Madurai, Narayan Netralaya, Bengaluru, with over 150 faculty talks, international, national awards, various publications in all reputed journals. He's also the section editor of refractive surgery of DOS Times, and his special interests are keratoconus, refractive surgery, corneal transplant, cataract surgery, and dry eyes. Over to you, my close friend Tushar Grover.
Thank you so much, Karan. So without wasting too much time, let's start the next set of questions. So this is the MCQ set 2. So the first question in this is, when you look at the clinical image below, which procedure has been performed in this patient? The options are cyanoacrylate glue application. The next option is conjunctival resection. Third option is corneal patch graft. And the fourth option is an amniotic membrane graft. So your time starts now. Okay, and the answer here is cyanoacrylate glue application. So of course, a corneal patch graft or a conjunctival resection would be much more easily visible. You would see sutures in case of a corneal patch graft. Here you can see the slight crystalline kind of deposits of cyanoacrylate glue. So let's move on to the next question. This is a patient who had undergone penetrating keratoplasty a year ago and has now presented with pain, redness, and blurring of vision from the last 3 days. Which of the following is not appropriate management for this patient? Your options are immediate corneal scraping for smear and culture, B, increase frequency of topical steroids, C, remove loose corneal sutures, D, cyanoacrylate glue in case of corneal thinning. Your time starts now. Okay, so the answer is increased frequency of topical steroids. So this would not be appropriate management because you can see that there is infiltration and there is an epithelial defect. So this is indicative of an infection developing. And you can also, if you look closely, see there are some loose sutures. So increasing frequency of topical steroids would not be the right way to go here. Culture and smear to begin with, and any of the other modalities as and when needed would be required. So let's move on to the next question. This individual has developed a corneal opacity after healed keratitis. Vision is improving to 612 with refraction. So this is the best corrected visual acuity. What would be the most suitable next treatment option for you? The options are penetrating keratoplasty, RGP lens trial, phototherapeutic keratectomy, and intracorneal ring segments. Your time starts now. And the answer is RGP lens trial. So when you have somebody with a corneal opacity like this, the first thing you would do is do an RGP trial and see if the individual's visual acuity is improving with these contact lenses. Subsequent to that, if it is needed, you can consider a phototherapeutic keratectomy if the opacity is superficial, or even in advanced cases, go for an anterior lamellar keratoplasty. You would not consider a penetrating keratoplasty in this, and your first option would be an RGP trial in this. So let's move to the next question. This is a 75-year-old lady who has presented with worsening symptoms of discomfort, foreign body sensation, and redness in both the eyes. The conjunctival immunofluorescence has been done, which shows linear deposition of IgG and IgA and complements along the conjunctival epithelial basement membrane. What would be your preferred treatment approach? The options are oral azathioprine, lid margin MMG, ectropion correction, and D is symblepharon excision with conjunctival autograft. Your time starts now. And the answer is A, oral azathioprine, because one is the picture, the fact that it's present in both the eyes. You see there are symblifera present here, and your immunofluorescence shows IgG, IgA, and complements. So that is indicative of ocular cicatricial pemphigoid. And it is important to start oral immunosuppression as soon as possible in these cases so that you're able to prevent or reduce the progression of the condition. So that would be the right answer here. Let's move on to the next question. Which of the following conditions is not a known indication for the procedure that you see in this image? The options are A, infective keratitis, B, pseudophakic bullous keratopathy, C, refractive error correction, D, corneal scar removal. Your time starts now. And the answer is D, corneal scar removal. So Of course, we know this is corneal collagen cross-linking, which is primarily and most commonly used for keratoconus to prevent progression. But there are other applications as well. Its role has also been described in infective keratitis, which is called as PAX-CXL. It has also been described in refractive error correction, which is called as PIXL. And it also has some role in pseudophakic bullous keratopathy, where it by strengthening the stroma, it prevents stromal edema from developing. So it has some role which has been described in pseudophakic bullous keratopathy as well. Corneal scar is not an indication for this treatment. So that's all. So it's my great honor to introduce Dr. Madhu Udraj, who's a fantastic cornea surgeon and a wonderful teacher. And I mean, if you look in his clinics, the professionalism, the way he handles his patients is extremely impressive. Now I'll go on to the CV that's written here. So, sir is the chairman and managing director of Dr. Raju's Vision Tree Vishakhapatnam, and the co-chair and trustee of UVSM Eye Hospital and Trust. He's also the chairman scientific committee of Andhra Pradesh Ophthalmic Society. He's an advisor and Indian partner for Harvard Global Alliance for Medical Innovation and a volunteer faculty for Orbis Cybersight. He's also the honorary general secretary of the ISMSIS, IMSICS Andhra Pradesh chapter. Sir has done numerous corneal transplants, refractive procedures, and cataracts. He's mentored various long-term and short-term cornea fellows. He himself has been mentored by Dr. M. Srinivasan and Dr. Prajna from Arvind Madurai. He also has a refractive surgery accreditation from Singapore National Eye Center. He's done various international fellowships from Unimore, Italy. He's done a fellowship from Sweden and from Harvard, USA. He's developed the CorneView for corneal donor tissue evaluation. He was the first to perform a stromal transplant for advanced India. He's received various awards, including the AAO International Education Award and International Scholar Award. He's also an LDP graduate from AIOS and has won the International Heroes Award thrice. He's won various Best Paper and Best Video awards, including in APAO, AAO, and ASCRS, numerous papers, posters, and various invited talks. He has won 7 named gold medals in the Andhra Pradesh Ophthalmic Society, including for the best papers, the best video, and various other awards. He has also has 8 publications in international peer-reviewed journals. Welcome, sir.
Thank you. Thank you so much, Tushar. It's a pleasure to be here back again in Big Q. I thank both Bavankale sir and Shilpi ma'am for giving me this opportunity again in season 4. So we'll go to the quiz without wasting much time. So this is the third set of MCQs. The first question is, why is the tissue from donors younger than 2 years generally not used in corneal transplantation? The options are A, the corneal endothelial cells are not sufficiently developed. B, the corneal stroma is too thin. C, the tissue is steeply curved and flaccid. D, ethical concerns. Your time starts now. And the right answer is C, the tissue is steeply curved and flaccid. So that's the reason that we don't use donor tissue less than 2 years. It becomes very difficult to suture this flaccid tissue. Let's go to the next question. Best non-invasive method to visualize acanthamoeba cysts in the acanthamoeba keratitis is option A, AS anterior segment OCT, option B, confocal microscopy, option C, sclerotic scatter in slit lamp, option D, specular microscopy. Your time starts now. And the right answer is B, confocal microscopy. I think confocal microscopy is a very, very useful tool, especially in microbial keratitis, especially in case of parasites like acanthamoeba keratitis. And also you can identify fungal hyphae. You can also identify the linear bacteria and all. Sorry, the linear bacteria like Pythium and all these things. But otherwise, the only concern with this is the cost involved with the machine, and it's not easily available everywhere. Let's go to the next question. Which instrument is most accurate for measuring IOP in corneal scarring? The options are A. Applanation tonometry, B. Perkins tonometer, C. Tonopen tonometer, D. Non-contact tonometer. And your time starts now. And the correct answer is tonopen tonometer. This is an ideal way to measure IOP in cases of corneal scarring. We also use it as a preferred technique to look at the pressure post keratoplasty also. Let's go to the fourth question now. Corneal injury from UV radiation causes which one of the following? A. Damage to stromal collagen. B. Loss of epithelial cells. C. Thinning of the Bowman's layer. D. Loss of endothelial cells. Your time starts now. And the correct answer is B, loss of epithelial cells. So in case of this UV rays, sometimes you see a superficial burn, and when you stain the cornea, you see that it takes up the stain in form of loss of epithelial cells. If the UV radiation is high intensity, it can sometimes go to the anterior stroma also, but most common is the loss of epithelial cells. Let's go to the next question now. Topical corticosteroids are most safely utilized in which time period after an alkali burn to the cornea? And the options are first 2 weeks, B, anytime after first week, C, 14 to 21 days, D, 21 to 28 days. Your time starts now. And the correct answer is first 2 weeks. That is the acute phase in which you want to use these steroids. First, you want to use it as frequently as 1 hour and then slowly taper it depending upon the response. Once you don't use them in the acute phase, there is irreversible damage to the limbal stem cells and ocular surface. There is no much role of steroids once this acute phase is over. Right. So that is the correct answer.
Thank you, sir. So with this, we end with the first set of the MCQs. And now it's time for the unscramble the words. So this is the sample question for you. How we will play the unscramble the words. So it's a clear transparent tissue that covers the front of the eye. And this is the word, the clue to you. And your time starts now. So the time is up. So the correct answer is cornea. I hope everyone has understood. And with this, we again move on to Dr. Karan for the first set of unscramble the words.
Yeah, ready. Let's go.
Okay.
So the first one is, it's a type of laser used in refractive surgery. Your time starts now. So the correct answer to this is eczema.
Just to interrupt, see, as we are giving you the clue also, so even a single alphabet or the spelling mistake, it will be taken as a wrong answer. So you will have to be very specific while typing the answer. The spelling should be correct and all the alphabet should be in order. Okay. Yeah. So let's,
Okay.
yeah.
So the next one is pellucid marginal degeneration is a type of, time starts now. So very easy. The answer is ectasia. Next question. The distance between the back of the ICL and front of the crystalline lens is called, the time starts now. So the correct answer is Walt. Okay, so this is very important when you're doing your phakic IELTS. You can also see it clinically as well as you can measure with the help of an anterior segment OCT. So it's generally 500 plus minus, or corneal thickness, central corneal thickness plus minus half of the central corneal thickness. That is the range that you take according to AAU. Let's go to the next question. So hexagonality is a clinical feature of corneal. The time starts now. So the correct answer to this is endothelium. Let's go to the next question. The most common diagnostic tool for endothelial diseases is, your time starts now. The correct answer is specular. Very easy question so far.
Thank you, Dr. Karan. So with this, we'll move to one word answers by Dr. Tushar sir. So before we move ahead, this is a sample question, how you need to answer the one word answers. So like the posterior part of the eye is called as, and your time starts now. You get 20 seconds in this round. So time is up and the answer is retina. So with this, we move to the set of one word answers. So Tushar sir.
You know, Shilpi,
Yes,
let's
sir.
start. So the first question is, what is the ideal vault size in microns in a phakic IOL? So we want the absolutely ideal size here. Karan gave you a hint. I hope you didn't hear him. So your
Yes.
time starts now.
Yeah. And please don't write microns or anything. Just write the figure.
So the answer is 500. So a range of 250 to 750 is good, but the absolutely ideal vault size would be 500 microns. Moving
I
on to
think
the next question.
we should not consider this question.
Karan gave away the answer.
Yes.
That's okay. Bonus for them,
Yeah.
I guess.
Yes, yes. Those who are hearing properly and also listening to the this explanation part.
Extra marks for attentiveness. So the second question is, you see this slight video here. Which layer of the tear film is this modality visualizing? Your time starts now. And the answer is, this is the lipid layer. So lipid is your answer. This is interferometry, where you visualize the lipid layer of the tear film. So let's move on to the next question. The third question is, identify the surgical procedure performed here. We need just the short form, not the full name of the procedure. Your time starts now. The answer is DSEC. So you can see that there are just two sutures at the incision that's been made. It's longer than a 2.8 mm incision. It's about a 5 mm incision, which is made in DSEC. There are no other sutures, and you can identify the outline of the graft as well, which is possible in DMEC, not really that easy to do in DMEC. So let's move on to the next question. The fourth question is, which inflammatory marker is detected with this inflammatory kit? And the answer is MMP9. So this is the inflammatory which is used to identify the presence of inflammation in the eye, particularly in dry eye. And MMP9 is the inflammatory marker that this kit tries to find. Let's move on to the next question. The next question is, the second Purkinje image is the reflection from which surface of the cornea? Your time starts now. The answer is, it's the inner surface of the cornea. So the first Purkinje image is from the outer surface, the second from the inner surface of the cornea, and the third is from the anterior surface of the lens. So that's all with my one-word questions. We'll move on to the next. So now
Yeah,
yeah.
I think unscramble the words. This is set 2. Let's have the first question. HSV causes which type of ulcer? Which type of ulcer? Unscramble the words. the unscrambled correct answer is dendritic ulcer. So a typical dendritic ulcer is what you see in HSV keratitis. Second question. Obligate intracellular spore-forming parasite that usually affects the eye. And the hint is usually you see this type of conjunctivitis in rainy or monsoon season. And your time starts now. And the correct answer is microsporidia. So it's like microsporidial keratoconjunctivitis that we see. So this forms like a clumpy SPKs, and whereas in viral SPKs, they're more pinpoint-like, and here they are more like a spillover kind of an appearance when compared to viral SPKs. Question number 3. Connective tissue covered by epidermal tissue is called as, your time starts now. Time is up, and the correct answer is dermoid. Let's go to the fourth question. Type 2 granular dystrophy, corneal granular dystrophy. Identify the unscrambled word, which is a type 2 granular corneal dystrophy. Your time starts now. Time is up, and the answer is avellinodystrophy. Let's go to the last question. Precursor for Salzmann's nodular degeneration. Your time starts now. And the correct answer is hyaline. So I think that finishes the unscrambled words. We can go to the next round.
Okay, thank you. Thank you, Dr. Madhu, for wonderfully having some very interesting unscrambled quiz. Thank you once more. So now it's time for us, friends, to have a small break. We need a break, and it's a commercial break. Of course, the success, as I said in the initial part only of any show, happens because of a strong finances. And this time we are really thankful to Highness for believing in us and trusting with us and supporting us so steadfastly. So here is a small commercial from them. So thank you, His Highness, for this wonderful support. Now it's time for us to move to the next set of MCQs, and over to you, Shilpi, to help out Can I invite Dr. Karan Bhatia with his MCQ set 4?
Yes, sir. Already, sir. So, this question, a 45-year-old lady with meibomian gland dysfunction presented with a painful red eye and whitish lesions on the cornea. What would be the most appropriate treatment for this condition? Would you give topical antibiotics? Option B would be topical steroids. Option C would be topical cyclosporin. And option D would be systemic steroids. Your time starts now. So the correct answer is topical steroids. So you can see the hint from the meibomian gland dysfunction. And what you're seeing over here is marginal keratitis. So here's you need to give steroids and the patient will be better. Let's go to the next question. So what is true of the technique of endothelial keratoplasty described by this surgeon? So option A is any age donor tissue can be utilized. Option B, technical skill required is easier in comparison to other techniques. Option C, only DM and endothelium is transplanted. And option D, only the Descemet's membrane is transplanted. Your time starts now. So the correct answer to this is option A, but this doesn't mean that you're not going to take corneas as sir had said less than 2 years. You can use pediatric corneas 10, 12 years also in anything which you cannot use when you're doing other techniques. So this surgeon is Professor Dr. Amar Agrawal, a legend, and he developed the PDEC. So this PDEC technique is slightly different from DMEC and DSEC. So in DSEC, what you do is you transplant the posterior part of the stroma, the Descemet's membrane and the endothelium. In PDEC, you transplant the Duas layer or the pre-Descemet's layer and the endothelium. And in case of the DMEC, you transplant the DM and the endothelium. So the PDEC tissue is slightly thicker than the tissue that you use for DMEC, and the graft is prepared also in a very different fashion. It's more like a bubble that you would use while going for DALC. So let's go to the next question. So a patient presents with significant photophobia and visual decline 3 weeks after penetrating keratoplasty. Examination reveals a line in the graft and keratic precipitates. What is the most likely diagnosis? See, option A is microbial keratitis. Option B is endothelial graft rejection. Option C is sterile ulceration. And option D is graft failure due to ischemia. Your time starts now. So the correct answer to this is option B, which is endothelial graft rejection. What you're seeing is the Kharu-Dost line, which is as described here. Let's go to the next question. So which of the following is a contraindication to keratoplasty? So you choose the best possible answer here. So next question, the option A is ocular surface disease. Option B is history of glaucoma surgery. Option C is uncontrolled ocular inflammation. And option D is presence of an intraocular lens. Your time starts now. So the correct answer is uncontrolled ocular inflammation. So you do keratoplasties, post glaucoma surgery, and IOL surgeries. There are risks with glaucoma cases. Ocular surface disorders is a contraindication, but relative contraindication. But in case of any inflamed eye, you would never do it that time. So that's why I said choose the best answer. Let's go to the next question. So 40-year-old farmer develops a progressive corneal ulcer After eye trauma, examination reveals a wreath-like pattern of infiltrates on the cornea with irregular borders with hyperpion and stromal infiltrates. Gram stain shows gram-positive branching filaments. What is the causative organism? Option A, Fusarium. Option B, Aspergillus. Option C, Nocardia. Option D, Acanthamoeba. Your time starts now. So the correct answer here is obviously it's Nocardia. Whenever you see a wreath-like pattern word, you should always think of Nocardia in such MCQs. Yeah. Next questions. Yes. Over to you, Dr. Tushar, for the next set.
Karan. So let's start the next set of MCQ questions. You see this pentacam map here. You need to identify this condition. A, Tyrion's marginal degeneration. B, pellucid marginal degeneration. C, keratoconus. D, keratoglobus. Your time starts now. The answer is pellucid marginal degeneration. So you see this typical crab claw pattern, which is characteristic of pellucid marginal degeneration. So let's move on to the next question. You see this image below. This represents which of the following? A, ocular aberrometry. B, corneal biomechanics. C, refractive error. D, macular function. Your time starts now. The answer is A, ocular aberrometry. So this is an image taken from the eye trace, which is an aberrometer. So you can see that you have all the higher order aberrations and the lower order aberrations mentioned there. And you also see a Placido topography image. Let's move on to the next question. So the next question is, this individual who has an uncorrected visual acuity of 6.6 complains of frequent episodes of severe pain and foreign body sensation, especially when the individual wakes up in the morning. Which of the following is the least suitable treatment alternative? A, bandage contact lens. B, topical hypertonic saline. C, phototherapeutic keratectomy. Or D, photorefractive keratectomy. Your time starts now. And the answer is D, photorefractive keratectomy. So this is an individual who has recurrent corneal erosions and having an uncorrected visual acuity of 6.6 doesn't warrant photorefractive keratectomy. All the other options are possible treatment options for this condition. Let's move on to the next question. The next question is, which of the following procedures is least appropriate for this patient with stable keratoconus? And your options are A, scleral contact lens. B, Athens protocol. C, intracorneal ring segment. Or D, corneal collagen cross-linking. Your time starts now. And the answer is D, corneal collagen cross-linking. So as you can see, this is somebody with stable keratoconus, not progressive keratoconus. So corneal collagen cross-linking is not warranted here. All the other modalities can be used for visual rehabilitation in this patient. So they are all valid treatment modalities. Let's move on to the next question. What is the minimum accepted anterior chamber depth required for the device that is shown here? and this is in millimeters. The option are A 2.8, B 2.7, C 2.6, D 2.5. Your time starts now. The answer is A 2.8. So earlier, what used to be followed was a minimum anterior chamber depth of 3 millimeters. The current protocol is that you should have a minimum anterior chamber depth of at least 2.8 millimeters. So that's all from my questions. Let's move on to the sixth set of MCQs by Dr. Madhu.
Thank you, Tushar. So let's go to the last round of today's quiz. The first question is, which of the following is true about Moore's ulcer? A, hepatitis antibody may be seen. B, etiology is unknown. C, it is a common disease. D, it usually resolves without treatment. And your time starts now. Yeah, and the correct answer is A, hepatitis antibody may be seen. If etiology is known, it doesn't come under Moore's ulcer, and it's not a very common disease, and it usually requires treatment for resolution. Next question. Which of the following test is most appropriate in SLK, that is superior limbic keratoconjunctivitis? Option A, anti-nuclear antibodies. Option B, thyroid stimulating hormone. Option C, rheumatoid factor. Option D, SSA and SSB, strain specific antibodies. Your time starts now.
Hello.
And the correct answer is B, thyroid stimulating hormone. Let's go to the next question. Most common organism that causes infectious crystalline keratopathy. Option A, Streptococcus viridans. Option B, Staphylococcus epidermidis. Option C, Streptococcus pneumoniae. Option D, Staphylococcus aureus. And your time starts now. And the correct answer is Streptococcus viridans. This causes infectious crystalline keratopathy. Let's go to the next question. Identify the organism that you see in this picture. Option A, Microsporidium. Option B, Cysticercosis. Option C, Acanthamoeba. Option D, Pythium. Your time starts now. The correct answer is Acanthamoeba. You can see this typical double-walled cyst in this smear. Let's go to the last question. In hypoxic injury to cornea, the cornea becomes edematous due to accumulation of A, carbon dioxide, B, pyruvate, C, glycogen, D, lactate. Your time starts now. And the correct answer is D, lactate. Lactate leads to edema in case of hypoxic injury to cornea. And I think that finishes the last question for today's round.
Okay, thank you. Thank you, Madhu. Wonderful. All the quiz masters, Tushar, Karan, you can all now log in. Let us have a small chat with everyone. And let's, before we finalize, before the backend team decides who were the winners of the private practitioner category, because every episode we decide
We
who are the
decide
top
the
three people who
correct.
made it, and we would be inviting them on the Zoom platform. So meanwhile, Karan, Dr. Tushar, and we are really lucky. Can I have Suryanarayan sir with us? Yeah, sir, you can come live with us. Good
Yes,
evening,
doctor.
sir.
Good evening, sir,
Good
and
evening. Welcome.
nice being with you all.
Thank you. Thank you.
Welcome, welcome.
So viewers, Mr. Suryanarayan, he looks like a simple man sitting in a garden, so pleasant with a big tika over here. He's such a simple and a religious man, but he is no less. He's a big man. He's a CEO of His Highness, and we are really indebted and thankful to him for taking care of this season of Big Q. Suryanarayan sir, your team has worked very hard to get all the students, all the PGs enrolled, and my sincere most thanks from the whole BQ team. Thank you, and be with us for a while. We'll be chatting
Sure,
with the
yes,
private practitioners and
sure,
we,
doctor. And I would like to express my thanks on behalf of His Highness for this grand opportunity to you and all the quiz masters.
thank you.
And
Yeah,
we will also see how best we can do it even better in the coming weeks.
thank you,
Welcome,
Suryanarayan sir.
doctor.
It's very rare, very few people, very few farmers can understand the investment they are doing into such academic events, which has not much of returns from their angle. But we are thankful for acknowledging the contribution which BigQ is doing for the postgraduates and for the ophthalmologists, and for your contribution. We are in fact indebted. Thank you. So Karan, Tushar, all the cornea surgeons and the quiz masters are with us. So, so how was the experience? I think Tushar also, this was second season. For Karan, I think it was a second season, I believe.
Yes, sir.
It was third, but
But
last year I had to skip the thing for because of an emergency situation.
correct,
Uh,
correct. And
third
for
year.
Madhu, is a very old timer, old veteran quiz master with us since the beginning. We initiated, brain teasers. That time also Madhu was a part.
Yeah, but I think it has evolved over the past season, sir. I think you have put in a lot of effort to the shape what it has got now. You and Shilpi ma'am, I think hats off to you for taking
Nothing me, or my job. See, I still remember my days when we started. Me and Shilpi used to be the only quiz master. We used to collect all the questions, and in the very first season. Then the
yeah,
next season we got people like Madhu and all the quiz masters who started contributing to it.
yeah.
And now my job is only to collate and get people together and ask them to work hard for me, and I only do a piggybacking. So be it. But thank you, Karan and Madhu and Tushar for this wonderful contribution, and it was really an interesting thing. So I think we are ready with the top three
Private practitioner
practitioners who
result.
are going to be having. So their unique ID is going to be 83680 seed. The second number is 84478777573 win, and then 97693000455 par. Can I request all of them to please log in on the Zoom platform? We would like to acknowledge who were the private practitioner. We would like to see them, meet them personally, and we will also like to request Suryanarayan sir to then virtually felicitate them.
Doctor, they can raise their hands so that I can promote them as a panelist.
Yeah. So can you just raise your hands? These three private practitioners who are winners of the today's episode: seed, win, and par. Are you getting anyone?
Dr. Parth Palan, he's joining now.
Okay, Parth. Anyone else? Parth, you can come live. So Parth, कितनी बार आओगे यार स्क्रीन पे? हमें बाकी लोगों को भी आने का मौका दीजिए. So Tushar and Karan, this young guy is a final year DNB student from LVP. I think he has written his exam theory. Practicals are yet to be written.
Yes, sir. Theory is done. Theory results just came 2 weeks back. Now practicals will be on 27th February.
Congratulations. You have cleared.
Congratulations, Parth, and all the best for your practical exam.
Thank you so much, sir. Thank you.
So he's a
Congratulations, doctor.
Thank you, sir. Thank you.
So, Parth, you were on number 3 today. So, can I request Suryanarayan sir to virtually congratulate and felicitate him? Thank you. And the
Congratulations, Dr. Parth. And,
Thank you so much, sir.
And then as Dr. Madhu Duraju was saying, that all the best for your upcoming practical exams
Thank you so
in
much, sir.
February.
Thank you.
So, Parth, what are you looking at now? There are 3 cornea surgeons versus 2 retina surgeons, me and Shruti here. Which branch are you going to choose?
Not comment on this platform currently. It's a very controversial topic.
Wants to be politically correct.
Exactly.
You
No.
don't need to be politically correct.
No, probably if he's in LVP, he would be inspired more towards cornea. That's what I believe.
No, sir. Retina is also very good over here.
Thank you. That's it. So that is encouraging. With 3 cornea people shadowing me since the evening, it was so encouraging a word. They were really dawning on me. Thank you, Parth. Thank you, Parth.
Thank
So
you, sir.
we continue playing, and we wish you all the best in your future, not only for your DNB exams, but for your future career as well. Thank
Thank
you.
you so much, sir. Thank
And
you.
keep continuing and spread a word to other
Definitely, sir.
fellows and colleagues of yours. Thank you. Thank you. Sai, anyone else has logged in?
Not yet, doctor.
Not yet. I think then they must have been logged out. Beat. So once more, congratulations to these 3
All the
top people,
winners.
Sid, Win, and Parth. We could speak with, we could have a conversation with Parth, Win, and Sid. Somehow we are missing you. We would our sincere most congratulations to you. Your prize money would be delivered at your respective thing at the conclusion of the whole thing season. So I think it's time for us to now everyone to say goodbye. Thank you, Suryanarayan sir, for personally
So
being
most welcome.
here
Most
with
welcome.
us and encouraging us more so. Your presence definitely has encouraged us, and it is expecting us to do more, much more, and contribute from our side as well. Thank you,
Always,
Madhu.
doctor. Always, always.
Thank you,
Thank you.
Karan. And
Thank
thank you,
you.
Tushar, once more for wonderful episode.
Thank you, sir.
Got it through.
Thank you for giving us the opportunity, sir. Thank
Ayo.
you. Good night.
It
Madhu,
was
you are
a pleasure.
Thanks to all doctors.
Thank
Yeah.
you.
So nice.
Thank you, Surnaran sir.
Welcome, doctor. So nice of you. Thanks a lot.
Good
Thanks
night.
a lot.
Good night.
Yes,
Yes,
bye-bye.
yes. Good night.
Thank you.
Good night. Good night to all. Thank you.
So postgraduates, we will be meeting again after 2 weeks, and the date is going to be
So the 5th, doctor? 5th?
5th of
The
February.
4th or 5th?
And 5th February, and the theme is going to be glaucoma. So we will be having the questions basically predominantly on glaucoma. So be ready for that particular episode. You can refer more to glaucoma now. More you are focused from away from cornea to glaucoma, and be ready. So looking forward to meeting you again on 5th of February, same time, 7:30 p.m. with new vigor and new theme. Thank you.
Right.
Bye bye.
Thank you all. Good night.